Stress tests are a tool in the healthcare system to at least see if you're having chest pain, if it's coming from a chest pain or artery-related thing. So I talk about this all the time, and this is why our next book called Death of the Stress Test. And the reason why is I don't like the outcomes of this. And so let's go with the good outcomes. So let's say you do a stress test and everything's okay. You know, I've been doing this for, since 1999 now, and the amount of people that I've had a stress test before a heart attack is ridiculous. And the reason why is a stress test is only looking for advanced stages of heart disease. Imagine like a 5-lane highway system. All 5 lanes are open, no big deal. A stress test is looking for 4 or more lanes closed on that highway system. So it's looking for a plumbing problem. And if you don't have a plumbing problem, this is where you get a clean bill of health. 90% of heart attacks get missed that way. So this is why I don't like it as a tool to use to see where your risk is of a heart attack or stroke. Now, if someone's coming in and they've been told that they have symptoms of heart disease, it's a nice tool to look at. The stress test is a nice tool to look at to see, is this chest pain coming from a blockage or a plumbing problem? And this is where I think it's a good test to use. But what I don't like is now you're going on for advanced testing, and I'll talk about that a little bit later, but this is where we might go into nuclear testing or angiograms to look at what's going on. And that may not be the best option for that patient to go down that path, because at the Harford Clinic, our focus is to reverse a disease process. You can grow new arteries around blockages, and you naturally do that. You naturally do that in your body. At the Harford Clinic, we exacerbate that process.